A measles outbreak in Chicago. Local officials now say at least 8 people at a migrant shelter have tested positive this week.
So here right now to answer questions is Dr. Shira Daron, the Chief Infection Control Officer for Tufts Medicine Health System. So it's great to see you, Dr. Daron, as always. So most Americans are vaccinated against the measles. So why is the CDC responding so quickly to this situation in Chicago?
Measles is more contagious than pretty much any other infection that spreads in humans. It's so contagious that it takes a 95% vaccination rate to achieve herd immunity, which is when there's enough immunity in the population to prevent ongoing spread and an outbreak. And unfortunately, we've seen childhood vaccination rates dropping over recent years, which increases the risk to the entire community. And of course, some of the migrants themselves are under-vaccinated.
Right.
And like any vaccine, the measles vaccine doesn't prevent 100% of cases, and immunocompromised people are especially vulnerable.
Right. You know, many of us have never maybe even seen a case of the measles, but already this year, there have been 45 cases reported in 17 states. So, I mean, it's concerning. What say you?
Yeah, it is concerning. Measles was declared eliminated in the U.S. in the year 2000, but we've seen this varying number of cases per year in the years that followed. So far this year, we're on track to far exceed last year's numbers. And measles can be very serious. It has complications like pneumonia, swelling of the brain. Before the vaccine was invented, hundreds of children died of it each year. 1 in 5 unvaccinated people who get it will end up in the hospital.
You just mentioned vaccination data. We know that you follow the data very closely. So what is the risk of an outbreak happening here? And I'm going to be micro-specific, happening here in Massachusetts.
The data from Massachusetts Department of Public Health, they're good. They show about a 98% vaccination rate, but those data are from 2017.
Right.
Now, a 2024 investigation by a local news outlet found that in 1 in 5 Massachusetts schools, the measles vaccination rate was under that target 95%. So you could have an outbreak, and that means we need to focus on vaccinating those in the migrant community who are under-vaccinated, and also educating that growing proportion of non-migrant families that are requesting exemptions to routine childhood vaccinations.
All right, Dr. Shira Daron, we always appreciate your insight. Thank you so much.
Thanks, Dr. Daron. Take care.
Bye-bye.